Functions of vitamin D. Vitamin D plays several critical roles in the body, including 1. Calcium and phosphorus regulation. Vitamin D facilitates the absorption of calcium and phosphorus from the intestines, essential for maintaining healthy bones and teeth. It helps regulate calcium levels in the blood, contributing to bone mineralization and overall skeletal health. 2. Bone health. By maintaining proper calcium levels, vitamin D helps prevent conditions like rickets in children and osteomalacia or osteoporosis in adults. It ensures that bones remain strong and properly mineralized. 3. Immune system support. Vitamin D has immunomodulatory effects, influencing the function of immune cells like T cells and macrophages. It helps in the body's defense against infections and has been studied for its role in reducing the risk of autoimmune diseases. 4. Muscle function. Vitamin D receptors are present in muscle tissue, and adequate levels help maintain muscle function and strength. It is especially important in older adults to reduce the risk of falls and fractures. 5. Inflammation reduction. Vitamin D helps modulate inflammatory responses in the body, which can reduce the risk of chronic conditions like cardiovascular diseases. Sources of vitamin D. 1. Sunlight. UVB exposure. The primary natural source of vitamin D is the synthesis that occurs in the skin when exposed to ultraviolet B, UVB rays from the sun. A few minutes of sun exposure on the arms and face, 2 to 3 times a week, can help maintain adequate vitamin D levels, though this depends on factors like skin type, geographic location, and time of year. 2. Food sources. Animal sources. Fatty fish, e.g. salmon, mackerel, tuna, cod liver oil, egg yolks, beef liver, fortified foods, dairy products, e.g. milk, yogurt, plant-based milk alternatives, e.g. soy, almond milk, breakfast cereals, orange juice. 3. Supplements. Vitamin D2, ergocalciferol, derived from plant sources but less potent than D3. Vitamin D3, Kolanol, more effective at raising blood levels of vitamin D and is commonly recommended. Vitamin D deficiency. 1. Causes. Limited sun exposure. People who live in northern latitudes or have limited sun exposure are at risk. Darker skin. Higher melanin levels in darker skin reduce the skin's ability to produce vitamin D from sunlight. Dietary insufficiency. Lack of foods rich in vitamin D, especially in people with dietary restrictions, e.g. vegans. Malabsorption disorders. Conditions like celiac disease, Crohn's disease, or gastric bypass surgery can impair the absorption of vitamin D. Kidney or liver dysfunction. These organs play a role in converting vitamin D into its active form, so dysfunction can lead to deficiency. 2. Symptoms. Children. Rickets, characterized by bone softening, deformities, and delayed growth. Adults, osteomalacia, presenting as bone pain, muscle weakness, and increased risk of fractures. Nonspecific symptoms, fatigue, muscle aches, and general malaise. 3. Long-term risks. Chronic vitamin D deficiency can lead to osteoporosis, increased risk of falls, weakened immune function, and potentially a higher risk for certain chronic diseases. Vitamin D toxicity, hypervitaminosis D. 1. Causes. Excessive supplementation. Vitamin D toxicity usually occurs due to overuse of supplements, not from sun exposure or dietary intake. Over-the-counter supplements. Misuse of high-dose vitamin D supplements without monitoring blood levels can lead to toxicity. 2. Symptoms. Hypercalcemia. Excessive levels of calcium in the blood, leading to symptoms like nausea, vomiting, poor appetite, constipation, and abdominal pain. Kidney issues. High levels of calcium can cause kidney stones and calcification in tissues, potentially leading to kidney damage. Bone pain. Despite high levels of vitamin D, the imbalance can cause bone pain and weaken the bones. 3. Management. Discontinue supplements. The first step is to stop taking vitamin D supplements. Hydration and medication. In severe cases, intravenous fluids and medications like corticosteroids may be used to reduce calcium levels. Summary. Vitamin D is essential for calcium regulation, bone health, immune support, and overall well-being. It can be obtained from sunlight, diet, and supplements. Deficiency is common, especially in those with limited sun exposure or absorption issues, leading to bone-related conditions and weakened immunity. However, excessive supplementation can cause toxicity, making balanced intake crucial.